Let's see. So this is Matt Shu at Upright Health, and I am playing with the live stream feature of YouTube. I did not tell anybody I was going to run this test, so I'm curious to see what happens if I hang out here for, I'm going to say, maybe 3 minutes. So, news. In the next couple weeks, I'm actually going to be visiting Portugal and Spain. So I just wanted to shoot out a little message to all the viewers that if you happen to be in Lisbon, Porto, if you happen to be in Seville or Sevilla, if you happen to be in Granada and you'd like to meet up, definitely get in touch. You can shoot a message over to support@uprighthealth.com, and your message will eventually get over to me. Alternatively, you can also head over to the Facebook page. Oh, hey, there's people. People are actually watching. Hey, guys. Hey, Card1. And I've never used this before, so hi, people. Thanks for the likes and thanks for the views. So as I was saying, if you're in Granada, if you are in anywhere in Spain or Portugal, definitely let me know. Go on the Facebook page at facebook.com/uprighthealth. Head over to send us an email at support@uprighthealth.com to let us know that you're somewhere out there, and that message will get to me, and I'll see if I can meet up with you. It'd be really fun to meet some of our international viewers and just kind of chat about movement, about your muscles, and about feeling good and making your body feel better. Since there are people on there, which I did not expect at all, if you guys have questions and you'd like to actually ask a question, I've got I'll give you another like 2 minutes. If you got a question, shoot it over in the chat. I just saw a little chat message show up. So if you've got one, shoot it over and I will be happy to answer it. Let me see what these little buttons do. Yeah, all right. Well, this is the height of technology. Interesting. All right. Looks like card 1 is trying to say something to me, but it's not working. All right. Well, we're coming up to the 3-minute mark now. It looks like nobody's got an urgent, pressing question. So, for those of you who randomly popped in, thanks so much. And let's see, Lauren Ibrahim. Quick summarized treatment plan for thoracic outlet syndrome. So that's a really good question, Lauren. So, if you watched any of the other videos on thoracic outlet syndrome, my personal opinion of it, since my hands and wrists used to go so numb and hurt so bad, was from my experience and from what I've seen with other people who have gotten the diagnosis that I've had the opportunity to train, if you are able to reposition things, if you're actually able to get the head and neck in a better position, if you're able to get better control over the thoracic spine and rib cage position, and then also get better position of the scapula and deal with the musculature around the front of the shoulders, you can drastically improve all those symptoms that often get called thoracic outlet syndrome. Like with many orthopedic issues, this is, I think, one of those things where there's a name for a thing, there's a surgery for it, and the name and the surgery sound really convincing, but just based on the surgical success rates, it's pretty clear that that's not the best option. So, in my opinion, from my experience with my hands, wrists, and other people, you can mess with the muscles that actually close down this area that cuts off circulation, and if you can retrain these muscles to do the right thing, you're going to feel a whole heck of a lot better. And so I hope that answers that question, and I swear I saw another question just pop up from somebody here. Ah, let's see. Lauren, card 1, hamstring tendinosis. Ooh. So card 1, so he has years of hamstring tendinosis. What's my experience been like? Well, I wrecked my hamstrings playing goalie actually, years and years ago, and I wrecked it multiple times. So I've had a bunch of random annoying hamstring stuff happen in my life. So for me, what happens with my hamstrings is if I don't actually keep my adductors and my deep hip rotators opened up, my hamstrings complain quite a bit. So we've seen that with a couple people where the hamstrings get really tight and don't feel so good, and it's not something that responds to hamstring stretching. And then what they actually need to do is start focusing on other muscles. Like you look at the hip rotators, you look at your adductors, you look at the quads, and retrain those muscles, get those to be a little more supple and a little more pliable and compliant. And that helps balance things out so the hamstrings don't feel like they have to grab all the darn time. I really did not expect to see this many people on here. Let's see. Slow Like Honey 2. Good to see you live as well. Thanks for watching from Long Island. Lauren asking about thoracic outlet syndrome again. Is trigger point massage alone enough to fix it? I don't think so. My short and very strong answer to that is I do not think trigger point massage alone is enough to fix people's thoracic outlet syndrome. I think for most issues, most movement issues, most pain issues, it's very important for people to get over the idea that just massaging things is going to solve the problem. I don't think that's, I mean, if you're lucky and you're in the subset of population where that's true, awesome, good. But for many, many people, especially in today's world where we're all just sort of sitting on our butts all the time, I don't think just massaging things solves all the problems. And especially with something like thoracic outlet where your hands are going numb, and you have a lot of weakness in the posterior shoulders, I think it's, I don't think it's a good idea to get your mind set on just massaging things. And Slow Like Honey 2 asks about advice for femoral patella syndrome. Almost said femoral acetabular impingement. So femoral patella syndrome. So basically, I'm assuming Slow Like Honey 2 has some sort of ache in the knee or some sort of grinding sensation in the knee when they're doing stuff. Slow Like Honey 2, I'm not sure if you're a man or woman. So if you're having knee stuff, our general advice with anybody who is dealing with knee stuff is to be paying attention. You're a woman. Okay, I got it. So Slow Like Honey 2, you really want to look at what's going on with your hips, right? So if somebody's already told you you have this hip impingement thing, then you definitely want to be thinking about how you train your hips to move them better. So you have a ton of muscles that attach from above the hip joint and then down below the knee. So there's actually, we posted a video recently about can hip problems cause knee problems? I think that was the title. So there are a bunch of muscles that we talk about there. You have your gracilis. Actually, it goes all the way down below the knee. You have your quads. You've got your hamstrings that cross the hip and the knee joint. So when you have dysfunctional muscles, right? If you have muscles that are not controlling the hip joint well, they can very, very quickly and drastically affect the comfort of your knees. So just a quick example from my past, my left knee used to bug me a bunch when I was retraining my glutes. Like when I was actually really focusing on trying to get my glutes to get stronger, my left knee would just hurt and it would feel like something was pulling and jamming on the top of the knee, and it felt like it kind of wanted to explode. And what actually helped me at that point in time was actually using a lacrosse ball to massage my butt muscles, massage the piriformis, massage, at that time for me it was mostly the butt muscle. But I want to be clear that it may not be that for you. It could be maybe you need to massage more of the inner thigh. Maybe you need to be stretching more of the inner thigh. Maybe you need to stretch the quads. It can be a lot of things because there are a lot of muscles that affect the knee. And since you're having hip issues and somebody's claimed that a labral tear is causing your issues, then you really want to start focusing on the different hip muscles in various directions to see what is restricted and what you can improve, because really it comes down to getting those muscles to control your hips properly. You probably also want to check out a recent video about how do you know if you have a labral tear, or how can you tell if you have a hip labral tear. You'll see some really good information there about the importance or non-importance of hip labral tears. And also on that video, I think there's a link to actually to go to a hip labral tear guide where kind of detailed a whole bunch of the research on hip labral tears and the significance and insignificance of that diagnosis based on the research that's out there right now. And you're welcome, Slow Like Honey too. Thanks for the question and good luck with it. It definitely takes time to learn how to retrain your body, but the thing that I always encourage people to do is experiment, be patient, and you will make progress. It's actually an idea that I'm seeing a lot in a book called Back in Control by David Hanscom, which I highly recommend if you are looking for a book about back pain. This guy's a spinal surgeon who did a bunch of spinal surgeries over the course of many years, only to realize and accept that spinal surgery really did not make a lot of sense for people with back pain. And so he wrote this whole book about different strategies for getting rid of back pain that are non-surgical. And there are so many parallels between that and hip surgeries. It's kind of shocking. So if you have just hip pain, but you want to see what a surgeon says about a different orthopedic surgery, then that's a super good book to check out. That's David Hanscom, Back in Control. So I need to get going, but I see there's one other question from Gar Too Far. So what's the best and quickest workout to get rid of stomach fat? Hey, Silesium. Thanks for watching. Gar Too Far, what's the best and quickest workout to get rid of stomach fat? If you want the Hollywood answer, it's, I have this thing I can sell you that will get rid of your belly fat. If you want the real answer is generally you need to be watching what you eat. You need to be very mindful of what you're eating. It's a good idea to learn what macronutrients are so you can start getting the appropriate ratio of protein, fat, and carbohydrates that is appropriate for your body. You should also be learning to experiment to see how that all works for you, because individual variation does seem to make a huge difference. And exercise helps in terms of burning calories and helping encourage your body to develop lean muscle mass. But if you're expecting any one workout to just give you rock hard abs, it's sadly, as far as any of us can tell, not going to happen. Just one little example there, one kind of thing that people are shocked by is for most of us at Upright Health, actually I would say all of us at Upright Health, we don't really do that much cardio. So you will not see us doing hours and hours and hours of cardio. You also won't see us do hours and hours and hours of sit-ups, but we generally monitor what we eat, and not like to a crazy extreme, but we do monitor what we eat, make sure we don't overeat. We usually don't eat lots of ice cream before going to bed, but I cannot say that that's 100% true all the time. But we just kind of pay attention and keep the calorie intake reasonable, keep our protein intake high enough to fuel us for what we're doing, and that is basically how you do it. There's no magic workout that's gonna get you the rock hard abs, because if you're eating 4,000 calories a day, you will end up stacking fat on top of whatever muscle you have, and you're just not going to be able to see those abs. So make sure you just pay attention to what you eat. Let's see. K-ball, pain sucks, life shouldn't. Keep moving today for tomorrow. Whoops. What did I just do here? keep moving today. For tomorrow, going to Rifflandia. I have no idea what Rifflandia is, but definitely keep moving today for tomorrow. I definitely agree. And I almost censored somebody by accident there. Salacium, if you have time to make a video on it, do you think you could talk about what exercises patients with chronic fatigue syndrome can do? Wow, that's a really interesting question. So in my memory, from my memory, I think I've only had one client who had chronic fatigue syndrome, or had the diagnosis of chronic fatigue syndrome. So that was a really kind of interesting relationship, because anytime I would ask him to do something, he would actually say, well, I have chronic fatigue syndrome, and if this makes me tired, then I can't do it too much. And I remember thinking, this was maybe 10 years ago, I remember thinking that was not going to be a very productive way of thinking about things. From my own experience, when my hips were really, really bad, and my shoulders, wrists, hips, knees, and feet were all at their peak worst, I was always tired, and just walking from point A to point B made me even more tired. So when I was in that situation, I was trying to find exercises that would make things feel better, and I never had the chronic fatigue syndrome diagnosis, so and I've not done enough research to really strongly say anything about it. But what I will say is, from my experience, if things are not working well, and an exercise is somewhat tiring, that may not necessarily be a bad thing, right? Because even now, when I do an exercise that's difficult for me, I do get tired, but that means my body is going to learn how to accommodate, compensate, and get stronger for it in the next week. So, a couple weeks ago, if I was doing something like a back bridge on the floor, I would get super tired super fast. Actually, a couple months ago, I would get really, really tired really fast, and it would feel kind of overwhelming. But now it's not so overwhelming, because I've done it enough times and my body has adapted. So as far as exercises that might help you, I would say you might want to consider just trying easy exercises, gradually do more of them, and then just see how things go. And you can check out some of our shoulder exercises. The ones that we posted recently, a lot of them are good beginner exercises that you might find helpful. All of our hip ones too. If you get winded, you get winded. That's how the human body works when you do a new thing. So just gradually build the intensity up and see what you can get. That's just sort of like that's how human bodies work, right? So and I hope that helps you, Salacium. Yeah, low intensity exercises, start off there, and then just gradually work to get yourself to do more, right? That's how you grow. That's how you get better. That's how you get stronger. That's how you get more energy. And having seen it in my own life, you start wherever you can start, and then you just gradually push yourself to do a little bit more. Okay, so I really have to wrap up, because I'm going to get in trouble if I don't wrap up here. So let me try to answer everything in the next 60 seconds. So, or read everything here. K-Ball Rifflandia is a music festival in Victoria, BC. What's my top 5 reasons to exercise? Thanks. I'll give you one top reason to exercise. Just as a basic philosophy, I think the only time you stop moving is when you're dead. Even when you're sleeping, you move. So you might as well get good at moving and keep moving whenever you can. Also, because give you a second reason, because if you don't move, your body starts to hurt. So you may as well accept that reality and then start moving. I think pain in general is just a sign that you're not moving well enough in the right directions, or in the right ways. Richard Lai, hey Matt, doing some of your internal rotation exercises in your vid feels painful rather than an unpleasant stretch. It's hard to gauge. So is that normal? unpleasantness in that kind of stretch is definitely normal, but the intensity level you want to attenuate, so make it not so hard on yourself that it feels crazy. Especially with hip stretches, you wanna shoot for like a medium level of challenge, so it feels like a stretch and it feels like in the right area. Like if you're getting an unpleasant feels like painful around your knee, you're definitely going too far. If it's like super intense in the groin, you may want to just back out enough where it turns into a softer, more tolerable and still unpleasant stretch, because it's not going to be pleasant. Slow Like Honey 2, do live more often. Yes, all right, I will. Blunts 5, you miss Kristen. I miss Kristen too. I'm sorry. Cam W, you love our videos. Thank you, Cam. Patrick G, I need to help. You need to help Jason Genova get ready for the Ruby. I don't know what the Ruby is. This is probably something that other people know, but I don't watch enough pop culture stuff to know what the heck is what. Peter Hodson, this is such a treat. Thank you for watching. Patrick G, he's entitled to it, bro. I'm not sure what that is. And then Realization, woo boo live. That is right. We woo boo live. And Richard, thank you for watching. Realization, can I get a shout out, brother? I watch your stuff nonstop. Thank you. I just gave you a woo boo and a woo hoo, so I think you got the most shouts out of anybody here tonight. So Cam, okay, this is the very last question. Cam W, you snuck it in, just because you've got Bruce Lee icon there. So knee pain from squats, my only question I'll post. Yeah, knee pain from squats. I've gotten them. I actually, this past week I was dealing with a little knee pain from squats. I think everybody at Upright Health has dealt with knee pain from squats at one point or another. So I guess the answer is yes. And if you're looking for more information on that, if you search squats on the YouTube channel, you will find that we have a number of videos that go over squat stuff. We did one about hip shift in the squats. Definitely check out like the video we did on the shin box, or like how to improve your pigeon. It was like it's a very long title on that one. It's like how to improve shin box, pigeon, to help you get better external rotation. And also stay tuned, probably in the next, probably sometime in October, we're probably going to have some more videos on some deeper adductor stretches that we've been playing with. They are crazy painful, but extremely, extremely helpful for making squats feel smooth. So you guys will definitely enjoy that one. It looks like at this point we're getting a bunch of music recommendations. So I have no idea who all these people are. I just put it on Spotify and let it roll, and that's usually how that goes. So thanks everybody. Smith squats all day. Pigeon box search, got it, and staying tuned. Smith squats all day. I'm not sure what. Are you talking about Smith machine squats? All right. Well, okay. Go do. I hope you're not talking about just Smith. Cam W. Man, got me. Smooth squats. There we go. Smooth squats all day. That's what I'm talking about. Okay. Thank you everybody for tuning in. Have a great weekend. I am gonna be, as I said at the top of this, I'm gonna be probably gone for a few weeks, but I have at least 1 or 2 videos scheduled while I'm gone. If you are in Portugal or Spain by any chance, drop me a line, support@uprighthealth.com, or leave a message on the Facebook page, and hopefully, if I even get on the internet, I'll check it out, and then maybe meet some of you crazy people who are all out there all over the world. Thanks so much for watching, and as always, remember that pain sucks. Life shouldn't.